Hi everyone, and welcome to your OT 635 online module for the Code of Ethics in Occupational Therapy. My name is Ashley, and I will be facilitating the first YouTube video for you guys, and later you guys are going to meet Hannah, who will facilitate the second half. So today we are going to go through, hopefully you already took your pretest. If not, please pause the video and go take that pretest. The link to it is on the welcome sheet on your Canvas module for today. And then you're gonna watch this video. After this video, we're going to go through some critical thinking Canvas postings. And then you're going to watch a YouTube video called Part 2. After that, we're going to have you complete a fun Flipgrid activity, a reflective posting with Google Slides, and then you need to take the post test and a teacher survey. I know it seems like a lot, but it should take you guys anywhere from 60 to 90 minutes to complete everything. And all right, let's get started. One second, and I'm going to share my screen with you guys. Okay. All right, so as I said, we're going to be talking about the Code of Ethics. This is part 1. Okay, so our objectives. You're going to be able to explain why ethical principles are important in occupational therapy from a student, a clinician, and a client perspective. You're going to be able to demonstrate a violation of an ethical principle in clinical practice. That'll be your Flipgrid activity. You'll be able to list all 6 ethical principles after this YouTube video. And you will be able to choose which ethical principle is being violated in the 3 clinical scenarios. So the Occupational Therapy Code of Ethics includes beneficence, non-maleficence, autonomy, justice, veracity, and fidelity. So AOTA describes the importance of ethics in occupational therapy as occupational therapy personnel, including students in occupational therapy programs, are expected to abide by the principles and standards of conduct within this code. The Code of Ethics helps to guide and define decision-making processes and ethical actions in occupational therapy practice. So the first one that we're going to talk about is beneficence. This means occupational therapy personnel shall demonstrate a concern for the well-being and safety of the recipients of their services. Beneficence is any action that benefits another individual by preventing harm and promoting good. Using evidence-based practice and current practices when you're evaluating, planning, and providing interventions and assessments is a very good example of this in practice. A couple other examples would be keeping up with continuing education courses that are relevant to the practice setting that you are in once you're practicing OT. A couple more examples of this in clinical practice would be using appropriate evaluation and interventions that are specific to your patient's needs. So an example of this would be range of motion. Let's say that, like goniometry. If a patient doesn't need the goniometry done, you shouldn't subject them to that. But it also goes the other way where if they are having, if they have like an orthopedic injury or something, where they do need that, beneficence would be making sure that you do those measurements correctly and well for that client. And one last example would be reevaluating and reassessing your clients in a timely manner to determine if their goals are being achieved, and if they're not being achieved, how you either need to change the intervention or your goals to help that client reach them. Okay, the next one is going to be non-maleficence. AOTA describes this as occupational therapy personnel shall refrain from actions that cause harm. So non-maleficence is the obligation to not impose risks or harm, even if the potential risk is without malicious or bad intent. In occupational therapy, this means that if a client feels pain from a treatment intervention, the acute pain has to be justified by evidence-based benefits of the treatment. Some more examples of this in practice would be avoid abandoning the service recipient or the client by making sure you have an appropriate transition um, when you're unable to provide services for any reason. Um, this would be making sure that another therapist can take over or that you reschedule the client, things like that. Another thing would be avoiding dual relationships or conflicts of interest and situations in which you, as the practitioner or the student, or even an educator, researcher, or employer, are unable to maintain clear professional boundaries or objectivity. Okay, so the next one is going to be autonomy. This is occupational therapy personnel shall respect the right of the individual to self-determination, privacy, confidentiality, and consent. So autonomy is this concept that practitioners have to treat the client according to the client's desires, but also maintain the standards of care that are accepted for your profession, and while maintaining and protecting the client's confidentiality. So this means that clients basically have the right to make their own decisions regarding care that affects their lives. A few examples of this in practice would be making sure that you fully disclose the benefits, the risks, and the potential outcomes of any intervention and the personnel who will be providing the intervention and any reasonable alternatives to that intervention that they could participate in. And another example of this would be obtaining consent when disclosing information and answering any questions, or I'm sorry, after disclosing information and answering questions posed by the recipient or the client or even the research participant to make sure that they are completing the task you're asking of them voluntarily. Okay, so next we have justice. So justice is occupational therapy personnel shall promote fairness and objectivity in the provision of occupational therapy services. This refers to providing fair, respectful, and impartial services to clients. Justice requires consistent rule following to promote unbiased decision making and fairness. A couple of examples of this in practice would be, making sure you record and report in an accurate and timely manner and in accordance with any applicable regulations that the professional or academic world may have for you. Another example of this would be addressing barriers in access to occupational therapy services. This would be by offering or referring people to financial aid, charity care, or pro bono services within the parameters of the organization, and advocating for any changes to systems and policies that are discriminatory or unfairly limit and prevent access to occupational therapy services, or even things that may limit access for our clients. An example of this would be in one of your undergrad classes, you may have had the assignment where you had to go out into the community, into a business, and do all of the, you had to measure doorways and see if the bathrooms had handicapped stalls and make sure the counters were at a specific height so that anyone with any disability or handicap could enter the facility and participate in things at that facility. Yeah, so we're going to move on to veracity. Veracity refers to occupational therapy personnel shall provide comprehensive, accurate, and objective information when representing the profession. So veracity is based on truthfulness and providing comprehensive, accurate, and objective information and fostering understanding of that information. So when entering a therapeutic relationship, the client has the right to accurate information and the right to understand that information. So some examples of this in practice would be recording and reporting in an accurate and timely manner and making sure that you are following any applicable regulations that your organization has for you. Another example of this would be identifying and fully disclosing to any and all appropriate persons any errors or adverse events that would compromise the safety of your clients or service recipients. And another would be describing the type and duration of occupational therapy services accurately in professional contracts, including the duties and responsibilities of all involved parties, so yourself, the client, your employer, if that's the case. Yeah, so that's veracity. All right, we're moving on to our last one. Ooh, went too far. All right, our last one is going to be fidelity. This means occupational therapy personnel shall treat clients, colleagues, and other professionals with respect, fairness, discretion, and integrity. Fidelity refers to an individual's duty to keep a commitment after it's been made. So fidelity in occupational therapy means that the OT needs to meet the client's expectations and needs, there we go, and maintain a professional relationship. A couple examples of this in practice would be making sure that you preserve, respect, and safeguard private information about employees, colleagues, and students unless you're otherwise mandated or permitted by relevant laws. Another example would be addressing any incompetent, disruptive, unethical, illegal, or impaired practice that jeopardizes the safety and well-being of others and the team's effectiveness. And lastly would be to avoid those conflicts of interest or conflicts of commitment in employment, volunteer roles, or in research. Okay, so we are going to move on to your first assignment, which is going to be the critical thinking and reflective questions. So you're going to answer the following questions for 3 scenarios, and then you're going to post your answers in the discussion post that was hopefully posted for you on Canvas. So the 2 questions are going to be, what 2 ethical principles are violated in the scenario, and what could be done differently to adhere to the code of ethics? So after this video is over, you're just going to hop onto Canvas. You'll be able to see the scenarios there on that posting, and yeah, just write out what you think it is. And then you're going to come back to YouTube for part 2. If you have trouble finding the link to part 2, in that welcome sheet we created, there is a link to the part 2 YouTube video. Okay, that is all I have for you guys. Welcome to your first year in the occupational therapy program. We hope that you are loving it. And yeah, see you guys in the fall.